everybody inside. It's an important topic we're going to start now. Masters will be issued after the completion of our section will be preferable. After the completion of this section, we will start issuing the marks card. Now we are going to discuss about the diseases. You believe diseases are diseases? This is discomfortable, right? It's not called as a totally disease. The person who has fatigueness or lethargy, the activeness and inactive. Active is considered as a health, inactive is considered as a discomfortable or dis-ease. It's not easy. Now we need to understand the existing diseases are not yet diseases. It's just as a discomfortable to the human being. Right? Now I told you there are the thousands of diseases, but now I can say here no diseases. But what they have the issues, the health status is not good. On that condition, we need to understand what they have the imbalances, what they have the diseases, what they have the unable to perform their activities. On that condition, we need to understand through the pulse diagnosis. What the pulse is, we need to do. What the diseased names are coming in front of us, and I told you there is some disease is mentioned in the Google search, and they are bringing their acupuncture points. Their constitution is different, what you have the issues. The cause of the disease for that person, for that particular discomfortable is different from the existing person in front of you, what they are facing. So therefore, what the persons express you, explains you, you need to treat for the health condition, not about the pathological diseases that what they are affected. In fact, if you keep manipulating that you have these issues, you have these problems, then certainly that itself will register in the brain. The brain giving the alertness always they have these issues in terms of diabetes or hypertension or AIDS or cancer or other related disorders. So these disorders I would like to say here is not a disease. There is some imbalance in our body. Hypertension is not related to the heart. Always keep it in your mind. The BP, the blood pressure is elevating. It is not related to the BP's excessiveness. That means related to the heart dysfunction. It is related to some other organ. For example, you can see the heart is dysfunction. Then it is related to the lungs, or it is related to the stomach, or it is related to the kidney, or it is related to the liver. When the other organs has been not functioning properly, that is reflecting to the other organs. You understood? Now I would like to say diabetes is not related to the pancreas. There is no related at all. Pancreas is affected. Due to that reason, the pancreas, the diabetes has been originated. This totally is the misconception. So, I am functioning here more than 1 decade. I am giving the lecture in related to acupuncture and in terms of other fields as a faculty. And first time my mother has come here. On the way she used to go to my native place, and fortunately my mother has come and my brother has come to take my mother. I welcome to my brother Ya Ataullah, and my mother is Rahatun Nisa. Yeah, the first step they came here to, on the way they want to pass the native place, welcome to all of my family. Here I would like to understand is the cause of the disease. We would like to know diabetes always registered, it is not related to the pancreas. Then what could be the reason? It is related to the liver diabetes, or it is related to the intestinal diabetes, or it is related to the kidney related diabetes. When the glucose function is not functioning properly, for example, what are the energy? Glucose is nothing but as a energy we require to the body. Have you understood? So therefore, what is the cause of these diseases? Normally, even in Ayurveda, we can say the elimination of the toxin, the assimilation and elimination process is not taking place. It causes the diseases. So therefore, here I would like to say the cause of the diseases is the constipation and other abdominal related disorders. When the digestive system is not clear, Dr. Mirza also told, has given very good scientific clarification about the gallbladder, why we need to take in the proper on time. Even I will come to that point also. So this proper indigestion itself, it causes several diseases. That is the cause for all the diseases. We need to keep it that in the appropriate manner to become the healthiest state. So therefore here once we place that in the normal level, so certainly there is no blood pressure. Even says that more than 200 by 100 and 140 blood pressure is there, need not to consider until and unless you don't have any pathology in our body. Are you understood? So we need to understand BP once you consider you are going for the some other doctor for the some other consultation in terms of fatigueness or lethargy. Then immediately they are going to see about the blood pressure monitor and they will consider that you have the hypertension or something. But why you have gone? It is not related to the hypertension. You have gone for some other issues. Then immediately they are diagnosed, this is due to this reason it causes these issues. But we believe in acupuncture, and initially you need to understand, I or ourselves or our organization, we are not denying to any system. Each and every system there is own limitations. So we can treat some other systems and other systems will treat better than our systems. Allopathy is very good in terms of our emergency. Right. In the long term of treatment, really I can tell you, this has been originated around 200 years ago. But this, our traditional Indian system has been originated around 2000 years ago, which you need to follow. The nature you want to follow, or you want to follow this, the chemical substances we need to understand and to be continued. If you follow this Western methodology, I believe, they are going against the nature. So we need to follow with the nature. So once we understand this philosophy, certainly we don't want to take the medicine first of all. Are you understood? So even I would like to say here, there is an act, that is the Drug and Cosmetics Act 1940, and the rules has been implemented in 1945. And then further reformed that in 1955, further has been implemented that rules, the incorporated rule 106. They have given very systematic in the Schedule J drugs. That is the Schedule J. That is there are the many schedules in the Drug and Cosmetics Act, Schedule H, etc. So therefore this Schedule J has given the information that there are the 51 diseases cannot be cured or cannot be prevented. You cannot make the claim to prevent or cure. The Act is giving this information. Drugs are giving this information to the mankind. Then why we need to follow the same? Why we want to go against these principles? Are you understood? Therefore, we strongly advisable If the blood pressure is elevated, we need not to follow, we need not to get excited that, and people says 160 by 100 doctor. The people, most of the people today, I would like to see the ego related issues. The person who have much fire, they says, no doctor, I have these kind of the diseases. Without telling doctor, they'll add up 2 diseases more and they'll highlight that I have all these diseases. So this is totally wrong information. If anybody says that you have the issues, you say I have positive that I don't have any issue. The way what you are going to express that you don't have any disease, then you need not to consider about the affecting the diseases that is existing with you. Even I would like to say about the renal diseases. Even it includes the 51 diseases in terms of first is AIDS. AIDS is not at all as a disease. Even in Tamil Nadu, I have seen around more than 1 decade, they are suffering for that, they are unable to take a single medicine, and they are living with both the couples, husband and wife, without having any issues. And today, since the international trend has given the very grief and very fright and fear information to the people, to the media, to believe this, and we are going to die very soon. And once this happens, we are going to die within another 2-3 years. So by placing that their intention, they are going to die certainly. So therefore here what I would like to tell to you, since you will become the practitioner on coming days, you will be treating for the thousands of patients. So on that particular time, we should be confidential. Confidence is the half of the victory. The self-confidence is the basic thing which you need to get the build-up as a comfortable confidence on you, that you will be confident to treat the patient and you believe in this system. And diseases, and moreover you need to understand is the basic thing. The issues will come to the body time to time. What are those? For example, giddiness. For example, vomiting, temperature, sneezing, that is rhinitis. All these things are essential to the human body.